And these days, anytime I have to speak with a doctor, it's a bit scary because back in the day when my mom would take me to a hospital, a doctor was like an old man, gray hair, really old, like you're thinking 70s-ish, you know? And he's telling you all these things. But these days, like I'm seeing a doctor and it's like, I feel like, are you allowed to go to the club? Are you 18 yet? How are you, Doctor? How do I call you? Dr. Eunice? Dr. Ntim?
Dr. Ntim is fine.
Dr. Ntim. How are you, Dr. Ntim?
I'm doing very well. How are you too, Natalia?
I'm fine, thank you.
That's great.
So today we're talking about drug abuse. I definitely have abused drugs. I mean, yeah, that's it. I have because I'm that person who, you know, back in the day when I didn't have that much knowledge, I used to think that if I'm told take this, you know, once every 3 times, and I take on the first day I take it first morning, afternoon, evening, and I'm starting to feel better, then my mind is telling me, oh, then if I make it 2 days, and I'll feel better fast.
That's interesting.
Yeah. You know, this is me back in the day when I was young and stupid. Now I know better. And I know there's so many people who do that. And so many people who would also self-diagnose and prescribe all kinds of things. Now, of course, because, you know, we're in the day of the internet, people Google symptoms and Google all kinds of medication they have taken, all of that. But I believe that, you know, let me leave the conversation to you. You're the professional. Let's talk about drug abuse. When we say drug abuse, what exactly do we mean?
So if we were to explain drug abuse generally, drug abuse is using a drug without medical justification.
Right.
Typically, drugs are intended to treat diseases, to manage diseases, or to prevent diseases or conditions. Now, if you're using a drug or a substance for any purpose other than for a medical justification, for instance, you are using the drug to feel good or to feel high, and it is not a medical justification, then I'm sorry, but you are in the bracket of drug abuse.
Right.
Drug abuse is a broad term. It encompasses many things. For instance, if you should use a prescription-only medicine, a drug that you're supposed to take with a prescription, if you use that prescription-only medicine without a prescription, that is drug abuse. If you use a recreational drug, a drug that is typically illegal in Ghana, that is also drug abuse. Drug abuse is broad, and we can talk about it in so many different ways and from so many different angles.
Right. That's a very, very interesting. So tell me, what kind of drugs are typically or usually abused?
Okay, so let me talk about 2. There are the legal drugs. When I say legal, these are drugs that are routinely used in the hospitals, and you find them on the shelves in pharmacies. So these include your opioid analgesics. These include drugs like morphine. You would also find another group of drugs which we call in medical terms NSAIDs. They are a type of painkillers. Some include diclofenac, brufen. These are also some drugs that are typically abused. Now, these fall under the bracket of legal medicines.
Right.
Now, when you come to the illegal ones or the recreational ones or the illicit ones, that is where you have the mention of cocaine, marijuana, and the like.
Right.
Lest I forget, alcohol is also legal. It is in Ghana, caffeine as well, but it is also among some of the most commonly abused drugs in Ghana.
But does alcohol fall under, would you consider alcohol a drug?
Alcohol is a drug.
Okay.
Yeah.
That's very interesting. I love to drink wine. Am I abusing it? And every time I tell them, one of the things I like to say is that I don't know how to drink a glass of wine. Like when I have to drink wine, I'm drinking a bottle. I don't, which doesn't happen often, but yeah, that's just what it is. So what would you say? What would you call that?
So the truth of the matter is,
Right.
drug abuse can quickly lead into dependence
Okay.
and substance use disorder. And in that situation, it becomes quite problematic.
Okay.
And alcohol has the tendency to cause dependence. And so my advice will be to take in moderation.
Yeah, my moderation is a bottle.
That's interesting,
Yeah, but I
Natalia.
mean, I'm obviously not dependent on it. I can go a whole year without drinking wine. But when I get to it, it has to be a bottle. Right. And so let's look at the trends. First of all, how do people fall into this space? I, once upon a time, have been given a drug that I was unwell, and part of the drugs that I was given, there was one that made me feel so good. It made me feel woozy, and I slept really well. So when it finished, I was like, I really think I could use more of this, like it made me feel really good and sleep really good. So I was really relaxed and all that. And I can understand why, anybody would want something that makes them feel good, right? But, like, what is the trend? How do people fall into these?
Yes, so as you mentioned, that is actually one common way people fall into drug abuse. When
Right.
they go to the hospitals and they are prescribed some of these medicines, they've been given them under prescription, but after they have completed those medications, they come home and they want more, and they go to the pharmacies to get some of these medicines without prescriptions. So that is one way someone can become dependent on some of these medicines.
Right.
There's also another phenomenon where people share medicines. So I take a pain reliever, what we call a painkiller, and it works for me. And one of my friends tells me, oh, my back hurts or my waist hurts.
Take
and
it.
I say, oh, take it. Meanwhile, that medication would have been prescribed me, but there has been no assessment of you whether you do need that particular medicine. Who knows? That could even be a medicine that you could become dependent on, and then you become hooked. Others also hear their friends talk about some of these recreational drugs, and they become curious. Oh, what's this about? I want to try it. And then they fall in. So drug abuse,
So these are
can
usually
happen.
the trends.
Yes.
And what would you say are some of the factors that have contributed to the rise in drug abuse in recent times? Because I'm told that these days, for a lot of the Gen Zs, when they are throwing parties, it's usually full of recreational stuff.
You're right.
Why is that? Like, why has it become such an in thing that, I mean, they seem to not be able to do without, Like, if I'm having fun, then this has to be part of the fun.
As a pharmacist, I would mention easy access to these medicines. Unfortunately, sometimes you would go to a few pharmacies, and some of these young ones are able to get some of these medicines without prescriptions. So that could be one of the reasons some of these are happening. As I also mentioned earlier, some feel that they need these drugs to feel good about themselves, to have a good time. And I am a young one. I like to have fun. And so with the understanding that I need a drug to feel good, then I throw a party and then drugs have to be present. So some of these things happen. In 2017, the Narcotics Control Board, they did a study, and they realized that about 50,000 people are using drugs. And interestingly, about 70% of this number are young ones, which means that sometimes even before these young ones have turned 18, they have been exposed to these medicines. Sometimes they have users in their families, sometimes in their neighborhood. So that's what happens sometimes.
But typically, where do they get them? Because you did say the availability. Available where? Okay, no, wrong question. I obviously won't want you to answer that so they know where to find it. But how is it that it is so easily accessible?
So that is a problem. Ideally, there are medicines that are classified as prescription only medicines. So strictly, such medicines should not be available without a prescription.
Right.
So if someone by any means has access to these medicines without a prescription, then we have a problem. We do.
So why is it that pharmacies will sell to you without a prescription?
A pharmacy would sell a medicine when it is not a prescription only medicine without a prescription. I work in a pharmacy, so if you come to a pharmacy to buy something with a prescription, among the first things I do is to vet the prescription. So I'll check whether the prescription I have is valid, that it has your name, your age, for example. It has the signature of the prescribing doctor. Sometimes it even has a stamp. And usually or sometimes for an extra layer of assurance, I will phone the prescribing doctor to ensure that everything is in order before I serve such a medicine.
Right.
There are other classes of medicines that are over-the-counter medicines. You do not necessarily need a prescription to get them.
Right.
Some of these are vitamins, some are dewormers. You do not need a prescription to get them. So when you come to the pharmacy, some of these medicines are available to buy.
Right. So typically, if somebody brought a prescription to the pharmacy and you sold to them, do you cancel out the prescription?
It is recommended that you indicate the dates that the prescription was served. Now, when you do that, it's a sign that you have served that medication. If for some reason you have served only part of the quantity, for instance, the person needs 60 tablets, a 2-month supply, for instance, and for some reason you were only able to supply 30, you indicate 30 tablets dispensed, so that should the person take that prescription to another facility, another pharmacy, they know that the person needs 30 more tablets to make the full prescription.
But if you're able to give them the full, do you then have to indicate anything on
Yes.
them? Okay.
Actually, it is recommended that we keep the prescription. That is
Right.
what the law requires.
Okay.
So you keep that prescription in the pharmacy for 2 years. You indicate that it has been served, and then you keep the prescription in the pharmacy for 2 years. That is what our professional guidelines indicate.
Right. However, not a lot of you practice it, I might say.
That is a problem.
that is another whole problem, because I have kids. And so from my first to second, third, whatever, anytime I've had to go and get medication from the pharmacy prescription, they never take it from me. They look at it, give me whatever, and I take it back home, and I have it. And I'm here thinking that sometimes even the date is not checked, right? For most people, it is what exactly has been written there. I look at it, I have it. And then you go. And it's also a matter of, I'm selling my drugs. I really couldn't be bothered. That's your problem, So I feel that maybe on the side of the pharmacists, they are also not doing a very good job.
I wouldn't say that categorically, because per our professional guidelines, that is what we are supposed to do. And I could convince you that I do that.
You don't need to convince me. I can tell that you would practice that.
Exactly. That is what many pharmacists do. So if there are a few that are not doing that, then I am by this means encouraging all of us to
do that.
Yes,
To do
vet
that.
the prescription, serve it. Yeah.
Right.
I trust my people.
You trust your people.
I trust my people.
Okay, I'm yet to trust them, but we'll get there. So tell me, what are some of the health consequences for all these drugs that are being abused? And also, typically, what advice would you give? So, for instance, for me, when I said I felt the way I felt about this drug, I was like, I want more of it. Sometimes people want to feel a certain type of way, but I want to believe that there has to be other ways that you can feel a certain way without resorting to using drugs, right? So if there are, and you can mention, maybe that will also help.
So the reason drugs that cause addiction make you feel that kind of way, that woozy feeling, is they actually affect the way your brain works.
Right.
And typically, your brain likes to reinforce behaviors that make you feel good, which is why whenever you eat and you feel good, your brain releases certain chemicals to reinforce that feel good behavior, so that whenever you feel hungry, you feel the need to eat.
Right.
The unfortunate thing is that these drugs of abuse take advantage of that process. So it makes you feel that you need those feel good drugs for sustenance or for survival. And that is where dependence enters the story. When you take drugs like alcohol, tramadol, cocaine, they can affect you from your head down to your toe. The worst case scenario is when you develop a substance use disorder, which is a medical condition. It can subsequently result in death.
Right.
Now, when that hasn't happened yet, from your brain, for example, it can lead to certain mental health conditions like anxiety, depression, psychosis. You see things, you feel things, you speak to people that do not exist. Your brain structure permanently distorts, it changes. You can also get respiratory infections, for example, in your lungs. You have heart disease. You can get congestive heart failure. You can get coronary artery disease. In fact, smoking has been listed as one of the commonest risk factors for many of these conditions.
Right.
You can get kidney disease, you can get liver disease. It can affect your reproductive health as well. So from your head down to your toe, it can affect you.
It can affect you. All right. So also what happens when somebody comes to the pharmacy, they do not have a prescription, but they want a certain drug? What do you do in that situation?
Okay. So sometimes you can tell that this is a person that is looking for a drug that can typically cause addiction. So we, as professionals, as pharmacists, balance being empathetic with being firm. We have the power to exercise our professional judgment to refuse to serve this medication. And that is because it is for your own good and it is for the good of society. Now, when we refuse to serve this medication, we have the ability to recommend an alternative medication that can help you deal with whatever problem that you're dealing with. Most of the time it is pain. So we have certain pain meds that have a lower tendency to cause addiction. And then when the situation calls for it and we can tell that this person has the tendency to develop a mental health disorder or substance use disorder, then we can refer the person to the appropriate mental health expert.
Great. Okay, so let me ask you, when I was talking about, because I've had kids, I've learned on the job, right? And so there are certain things that, and I know that mothers do this typically. It's a problem that mothers have, right? Because for my first child, anytime she was ill, I saw, okay, this and this and this happened. She felt this way. I went to the hospital. She was given this, da-da-da-da-da. And so when you have the children that come after her, it feels like the rules apply. I've seen this before, right? This has happened before. When it happened, we did da-da-da-da-da. Or even with the same child. If something has happened prior and you went and got this and that and that, when you see the same symptoms again, you feel like, same thing. No need to go and waste money at the hospital. Let me go.
Actually.
Yeah, let me go and tell Eunice, Dr. Ntim that, Dr. Ntim, give me this and that and that and that. Give me amoxiclav, 125. Give me this, give me that. Like, I know all the medication that I've learned because of mothering. So sometimes the rules apply a lot for mothers because we feel like, oh, this is familiar. And usually when it's like this, I buy this and that and that. It's not a prescription that has been given, right? But you feel like you're using your mothering instincts and familiarity and, whatever has happened to come to that judgment by yourself. What do you say about things like that?
I particularly like that you have brought this up. You know, amoxiclav is an antibiotic, and antibiotics are in classes. So, should you take one particular class, there are many different antibiotics in that class. Now, the thing about antibiotics is, over time, the bacteria that the antibiotics are supposed to target build resistance to them. So when you use the same antibiotic consistently, continuously, you build resistance. Therefore, if your first child, or even the same, call a pharmacist or call a doctor or tell him, we have done amoxiclav before.
Right.
What other antibiotic can we use? We would even have to establish whether the patient or the child in this case needs an antibiotic in the first place. Sometimes the infection would pass on its own. So all these things would be considered, which is why you should always speak to your pharmacist.
Always. Don't be like Natalia and go and get, I know all the medication that my kids take. Oh my God. So I go and I get, especially when they have a cough. Cough, dear. I'm a pharmacist for cough.
Oh my goodness, Natalia. I'm not happy. I'm not happy.
I'm a mother pharmacist for cough for my kids. I know all the things they. Okay, so I'm going to change. Moving forward,
I'm happy to hear that.
You know, in the beginning, I said that we all abuse drugs, like from time to time. It's such a Ghanaian thing. It's something that we don't take very seriously, but it has to be taken very seriously. You know, because we feel like, oh, you know, even with ourselves, right? We do the thing where when I feel a certain type of way, I say, this one day, it is malaria.
Yeah.
You know what I mean?
That's true.
With no test, with nothing, and we go ahead and take whatever we think we take when we get malaria. And we started without anybody saying nothing. You know, it's something that we do all the time. So I think let's wrap this up, right? What do you want society to know and do? What would you recommend as the best practice? Also, in giving this recommendation, keep in mind our economic situation as Ghanaians, which is part of the reason why a lot of people make some of the decisions they make when it comes to health.
I agree with you.
You know, because it's like, Charlie, I don't have money to go and waste so. And sometimes you go to the hospital, is the reason why I'm mommy pharmacist. You because most of the time I feel like, oh, this one day is this or this or whatever. But against your not so good judgment, you take the child to the hospital, and the doctor will give the same thing you were thinking. I'm like, you see, I was right. Meanwhile, they have taken me consultation fee and this and this and this and all of that. So best practices, okay, for everybody. What are the things you need to know, the things you need to do when it comes to things that you ingest, medication that you ingest? What should we know? Keeping in mind the economy.
So let me itemize them.
Right.
But in no specific order. 1, trust your pharmacist. If you come to the pharmacy, okay, and I tell you per your symptoms, it is unlikely that you have an infection. So it will not be good, it will not be healthy for me to give you an antibiotic. Please trust me. Please trust me. Please trust me.
Yes.
Secondly,
I will trust you.
Secondly, do not share your medications. Don't share them. No matter how similar the symptoms may be, she may have what we call a comorbid condition, another condition that complicates her situation worse than yours, or you may, which may not make the two symptoms or situations equal. So do not share your prescriptions. Now, when we come to these illicit medicines, it will be good for parents to have a healthy communication system with their children. Some of these young ones hear about these things in school. They may have a lot of questions, but they may not have a good avenue to have these concerns addressed. Then they turn to their young ones, and before we realize, we have substance use disorder on our hands. So that is another advice that I will give. In summary, trust your pharmacist.
Trust your pharmacist. Thank you. Doctor, you for Eunice. In fact, I have a sister called Eunice. I call her you for Eunice.
Oh, that's lovely.
Thank you so much. We really appreciate the education, and we promise we'll do better. I promise I'll do better. The only thing I'm not sure I can do is cut back on the bottle of wine. That one day, that will be tough. But we really appreciate this. Thank you so much. You're coming from where?
I am coming from Draxer Therapuetics.
Okay. Where are you located?
We have a retail shop at Bachonas Pentex.
Okay.
Yes, off the Kotobabi Road.
Right.
Draxer Therapeutics deals in vitamins. So if you are looking for a trustworthy brand for your vitamins, Draxer Therapeutics is where to
I'll come
turn
to you.
to. That's
I'll come
right.
to you. These days I've heard about some vitamins that we need to take, but I'm also not big on, because of social media, you go on TikTok and the likes, and people are saying that take this, you need to, as a woman, if you're aging, take vitamin, take this, take that. And this is an individual who's not coming from any medical background, right? But maybe they may have used it and they think it's working. So they come and start recommending things. If you go on TikTok, they are there plenty. Every day they're recommending different things. But I will definitely come. That's where you are.
Yes, that's actually the beauty of Draxer Therapeutics. The team is made up of pharmacists.
Okay.
So our recommendations are unbiased, and we make sure that whatever vitamin that is recommended, you truly need it. That's the
Okay.
beauty of Draxer Therapeutics.
Okay. So I will come. When I come, I'll see you.
You
will
meet me, and you can meet Dr. Ayensu here, Solomon
Dr. Ayensu, okay.
as well.
Okay.
Yes. You can also call us. You can call us on 055 711 6113
Okay.
or 0538 655 620.
Okay.
You can visit our website www.draxer.org, where you can book a consultation and speak to a pharmacist.
Okay.
You could also visit us on Instagram at draxer.therapeutics. Draxer is spelled Draxer.
Okay, great. Thank you so much, Dr. Eunice Ntim and Dr. Ayensu. Thank you for visiting us and giving us the education. We promise we'll do better, so help us God. All right, more music coming your way. This is Those